So go ahead and tell me what brings you in then.
So I currently am experiencing really bad pain behind my shoulder, like my scapula area. It makes it very uncomfortable to sleep. Sometimes I'll get numbness going down into my hand.
Okay.
And then
When did that start?
it's been probably about a month for this pain to be there. I usually wake up with it. Like, once it goes away, the pain goes away. It just, like, takes time. And then once it goes away, when it comes back, it's usually when I wake up in the morning. I can't really tell, like, what's exacerbating it. It's just there.
You're saying you notice it when you wake up in the morning, then it's probably how you're sleeping.
Yeah.
You need to fill in the gap between your shoulder and your neck. So you shouldn't be sleeping like this and you're closing the thoracic outlet when you do this.
Okay.
And maybe that's why it's switching. Okay, if you sleep on your side, if you're a side or a stomach sleeper,
Yeah.
those are the two risks for this.
Okay.
Okay. However, if you sleep on your back, that comes with its own risks. Okay, it comes
Yeah.
with a separate set of symptoms that people develop. Ideally on your back with a slight curve in your neck. You can go on your stomach, but you can't turn your head, because look at what happens. You open up the IVFs on this side and you close them on this side.
Yeah.
So you'll have arm pain on this side. If you go like this, you're going to have arm pain on this side. Does that make sense?
Yeah.
If you're like that, now it's over here. Do you understand? These holes, they're just holes that close and open and open and close. And if it's going down your arm, do you notice any weakness?
When I lift weights, I do feel like one side isn't like weaker than the other, but it looks like it's imbalanced. Like it looks like this side is higher than this side when I raise my arms.
That's normal. What would be not normal is weakness. Go like this for me and close your eyes. Do you feel unstable at all?
No.
No? Okay. Why don't I test some of your reflexes? When's the last time you had your reflexes tested?
Oh, probably when I was a kid.
Good. They're all working fine. Relax triceps, relax your arm. Relax your arm for me. There it is. Does that hurt your shoulder at all when I take you backwards like that?
Not this
No.
one. This one feels a little tight, but not too bad.
Okay. Go ahead and let's do muscle testing. Arm up like this.
Like this?
Yeah. And then push up against my arm. Good. I'm gonna pull. Good. Do I need to go slower, Linnea? I'm sorry. Pull. Push out. And push it. Good. And arms up like this. You're gonna push your wrist up against mine. Good. Same thing. Good. And then push down. Good. Push down. A little. Go ahead. Maybe a tiny bit of weakness. Not bad. Now grab my fingers. Don't let me pull out. Good. Good. My arms are like that, and then I'm gonna squeeze, and you try to not let me squeeze. Okay.
Okay.
Good. Nope. Well, there she is, right here. So yeah, what is your sleeping position?
Side sleeping, mostly on the
Okay.
right side.
Okay, yeah, definitely. We need to kind of maybe change that. Let your arms swing and come on back. So you're just a little tight up in, here. You're guarding yourself a little bit up here.
Okay.
If you're very guarded.
Yeah, sometimes I can't even reach over to pull my seatbelt because it'll send the shooting pains.
All right. Just feeling, okay?
Okay.
Overhead presses
Mm-hmm.
are gonna kill that. I can't do overhead presses. I have to keep my back out like this and just use my lats. They say it's your delts, but it's really a stabilizing with your lats to push up and not throw the shoulder up. But until you learn that, I tell patients just don't do it. Don't
Okay.
do over 90 degrees. Keep it here.
Okay.
All of your exercises here until you learn how to engage your lats, pull your lats down, and then go up with the delts. Very hard to do, but until I figured that out,
Yeah.
I was just bam, 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 pinching the thoracic outlet, pain down my arm.
Yeah.
Okay. And then you have to have your chin back. So literally, me doing overhead presses looks like this. Go. You know, I'm not just throwing my arms up.
Yeah.
I'm not. So you have a little bit of a scissor. C1 goes out to the right, C2 goes out to the left. That's one of the harder ones to fix. See how much she moves. Chin back for me. Here's C1. Moved a lot. You okay?
Yeah, I
jumped
was
off the table. Other side, okay. You gotta correct C2. Very good. Just let the blood go. I think I've gotten most of it, but there's definitely one left over here. I've got you. And there's C2. Very good. Excellent adjustment. For not being adjusted in how many years?
Many. Too many to count.
All right, I'm just going to leave that there, okay? We're just going to let that go. I'm going to work on your neck in a little bit. I'm going to go
Okay.
to your toes.
What were you going to say?
Her left foot is flared. So, like, if you're down, you can film this from over here if you want. See how the left foot is flared? So usually the side of foot flare is the side where she's placing her weight. We'll find out in a second. Ankles. Whoa. You're pushing weight up. There you go. Bend your knee for me. Relax. Excellent. Reach overhead and grab the table. Just give me some counter force just with your arms. Any tingling in your arms when you do that?
No, not right now.
Good. One more. Yeah, see, there's much more flexibility over here. Knee. Good. All right, arms down. Come on and sit up and take your neck for a spin. Any discomfort back?
Nope.
Doing okay so far?
Mm-hmm.
Go ahead and right, left. Feel pretty good?
Good. Mm-hmm.
Okay. And your hands go on the little pads here.
Oh,
It's okay.
there we go.
All right, here we go. Now you just kind of relax in there. Your face okay?
Mm-hmm.
Comfortable? Yep. Just gonna raise this one up. Take a deep breath in. All the way out. Excellent. And again, deep breath in. Good. And again, deep breath in. There it is. Perfect. That's over with. Okay. Yeah. Not too bad. No, she's good. You tell me if it's too much. Breathe. Keep breathing. Doing okay?
Mm-hmm.
Oh, there's a knot here.
I'm kind of tickles.
Sorry. All right. Yeah, there's a huge knot right here. Okay. Breathe. There you go. Oh, it's all over this right side. No sciatica though?
Mm-mm. Yeah, I feel that.
Yeah, watch for signs of sciatica on this right-hand side, okay? The nerve is already kind of calling out for help over here. Yeah. Okay, okay. Let's use my elbow right here. Okay. Okay, oil. Bend your knee. This is just preventative of care, okay? This isn't, I'm trying to prevent future problems. Like what's happening to your arm could happen to your leg.
Okay.
It's just preventative. Take a deep breath in. Five, 4, 3, 2, 1. Take a breath. 5, 4, 3, 2, 1. Trying to get it for you. Breathe. There you go. That's it. All right. Gonna go now to this shoulder, okay?
Okay.
Breathe. This arm behind your back for me. Yep. And then this arm behind your back. Let me compare the two. Okay. Yep, definitely right side. Now take a breath for me. And again. Good. Breathe. This one. This is the one we were talking about before, okay?
Mm-hmm.
Here we go. 1, 2, 3. Take a break. It's right at the base of the scapula, right down here.
Mm-hmm.
So I want you to breathe with me during this part, okay? This is probably the most important one for this problem that you have, but it's intense. And I want you to tell me if it's too much and I will stop, okay? Because there's no end to it. That's the problem. I have to make a judgment call. There is no end. It can... That's why I tell you guys, tell me. I'm gonna go right here. You all right?
Mm-hmm.
I'm doing a Superman pose on your back.
Not your leggings.
Yeah, Linnea's like, do Superman. Because really I could just stay here all day. There's nothing much to be done except to just stay here. So we get creative. So you just need pressure to coerce these guys. No. Too much? You okay?
No, that's good.
There she is. Okay, okay. Let me back off. I'll back off. Just put pressure. Is that okay?
Yep.
Okay. Whew. Okay, just pressure. Through them. It's coming out. You're doing really good. That one's gone. That one's still here. Yep. All right, we're gonna go to the other side. It's not really here.
Mm-hmm.
Okay, so your left side is the one that's all inflamed. Right side is getting pinched. Does that make sense?
Mm-hmm.
Okay, as long as you understand it, I'll keep explaining it. If you can understand how your spine curves, it will help you. One side gets opened and swollen, other side gets compressed and pinched. The side that's compressed and pinched is usually not the side, when I push on it, that complains. Even though that's where the symptoms are coming from.
Mm-hmm.
But that's why you can also understand why they're ping-ponging back and forth. Okay, so we're gonna start at the neck and we're gonna work our way down. So you're gonna tuck your chin for me. If this doesn't hurt, I'll do a little test run, okay?
Okay.
And you tell me. Oil is just so I don't chafe the skin.
Okay.
I'm not hurting your skin. I'm just bringing debris up to the surface. And there she is. We knew that one was there. This arm over your head. Just grab the top of your head for me. Do your infraspinatus. People always ask me, why don't I do cupping? I'm like, because when you do cupping, you're missing a lot of fascia in between, okay? I like the scraper because I can get the whole posterior chain here. Not anything against cupping, it's just my opinion. From, you know, several thousand bodies that I've worked on. And they'll leave it to their assistant to do it. I'm like, no. I've got to learn how to do it first. If I can't do it, then how am I going to teach anyone? About 4 to 5 vertebrae over here. Yep, there it is. You got marks from the roller as well that I used. So they're like tiny little train tracks.
Oh,
Just so that you're aware. What is this? We're going to take a picture.
okay.
Good. I just got to open this up. It's getting squashed. Okay. You all right?
Mm-hmm.
Okay. I'm looking for flinching. There she is. That's the rib. Oh, man. Us moms are tough. A little too tough sometimes. So you kind of keep watching. Sometimes we don't say anything. Very good. Okay, now you can come on down here. At the end of the day, it always surprises you where they are. Under her arm? Yeah. You know, I trace it down. And her adult. Hello. And the neck. Hear that? That's the scar tissue, okay? That's the what is a good word to use that YouTube won't kick me off for? Overworked area.
Okay.
So therefore it builds up scar tissue. Why is it better to do that? It's not stupid. It's like a callus. If I do this all the time, you think you'll build up a callus there?
Yeah.
Yeah, that's what this is. It's a little bit of a callus. But then it causes it to not move correctly. Your neck won't move the way I want it to. So I break it down just enough. Not all the way, You don't have somebody just wail on this, okay? They break it down piece by piece. All right, so here's your back.
Oh, yeah.
All right, so it did come out mostly like over here on the left, but on your neck it was mostly on the right-hand side here.
Yeah.
This is the compensation. So you're actually here and then here with your curve.
Yeah.
Okay?
Yeah.
You can kind of see where the muscle changes pattern here. That's where the jackknife is. Where it goes, and then it goes,
Yeah.
and the muscles go,
Yeah, like right here.
right there,
Yeah.
yep. Like just feel your neck, feel your back. Like come here. Yeah, like around here. Yeah, dude, what does it feel like to you? Can you feel it? Like you can touch it. You see how the skin is still intact? Well, feel up here. Like come up and over. Like, can you reach here? Do you feel that? See how it's just warm?
Yep.
The skin isn't broken. There's nothing bleeding.
Yeah.
You can go out in the sun. You can do everything that you want to do. It's just underneath the skin. It takes 7 days to go away, okay?
Okay.
I'm just cooling it down. Does it feel cold? You're supposed to shake it. And it gets colder as we go. I don't like ice packs. That tends to burn the skin.
Oh.
Yeah, right here's one. That's one that came out. This is almost gone now. Towards the end of the day, you know, it'll be probably mostly gone your lower back. Okay. I'm gonna go right here underneath your collarbone, okay? Right to here, just there. Any soreness when I do this?
A little bit.
Like, I'm not gonna lie, a little bit. And then head back for me, and then we're gonna get it. Yeah, that's it. Breathe for me. I'm gonna push against it. Yep. And breathe again. There it goes. Very good. Now for this one, your arm goes behind you. You're gonna look up and away from me. I'm gonna get into the pec minor here. Doing okay? You can look at it if you want.
Oh, yeah.
You're like, yeah. There we go, calming it through that. That's it. All right. Now you're okay. Okay. You did it. You did it. Just checking.
Yeah.
Much more flexibility over here.
Okay.
It's just gonna click all day. There's no point in setting it. Okay. Ugh. Wow. Okay, other side. I don't have to push very hard on you at all. I'm holding you to the table. I'm like, no, you're not going anywhere. I've never lost the patient yet. No flips off the table. Breathe. There it is. On your back. Yep. Hard as you can. That's all it is. Okay.
Yeah, it feels much better.
Hey, you just need to be cleaned out
Yeah.
every once in a while, okay?
Okay.
I want to show you a stretch that you can do at home. There's plenty of things you can do for the QL. For the QL, you know, you can do Cobra, you
can do bow pulling pose. You can do. Oh. She's like, that's the potential thumbnail. Fine.
Yeah, we both look like so contortionists.
Yeah, but you see how I can put a curve in my back this way? Okay, this is safe. This is safe. Putting a fulcrum down in there, not safe.
Okay.